And you're right. You're right.
Anyway, as an extension, I mean, if you ever have a chance to go to the Baltimore limb salvage, that's where it's kind of the crossing of minimal incision and external fixation, but it's the idea of doing osteotomy percutaneously with small incision. Anyways, Guido and Brad Lamb are the podiatrists who usually participate in that. So Guido's all about correcting the deformity and stabilizing it.
He's awesome. He is great. He's 1,000 times better surgeon than I am.
For minimal incision, when you visit in the office, do you do insurance, or are you guys not in contract?
Here's what I'm trying to do. Okay, I'll just be blatantly honest. I'm trying to do more cash pay. Okay, if we run out of cash, if this country runs out of cash, folks, I really don't care. If Medicare runs out of money, if Medicaid runs out of money, I don't care. I've got cash prices for literally everything that I do.
Your next country war can survive.
I am, yeah. If something happens to Medicare and Medicaid, folks, I really don't care. I really don't.
I got you up.
How do you decide? How do you decide between if the pain is coming from the Haglins or if it's coming from an insertion of tendonitis or retrocalcium or, and would that change your decision making surgically?
It could. For me, if I'm going to do one of these, I'm going to try to remove as least amount of spur as possible. Okay.
Have you ever had to go back and remove it more?
No. I've been practicing now for 10 years and I've never heard of anybody, and I'm not kidding, I've never. Hey, guess what? That's my open procedure. I don't do this anymore. I've got 2 on YouTube. One is open, one is minimally invasive, and I don't do that procedure anymore. So I've got 2. This one right here. It's this one. That's okay. You're fine. Hey everyone, it's Dr. James Kennedy's Texas Foot and Ankle Center. We actually created this YouTube channel for educational purposes and also entertainment. We hope that you'll subscribe to our YouTube channel and hopefully like us on Facebook. A lot of patients ask me, what is it like to be a podiatrist? Well, this kind of gives you an idea of what my day-to-day activities are at this job. Hope you'll really enjoy this channel. This is basically what podiatrists do on a daily basis. Podiatry is probably the best profession in medicine, or it has to be one of the top, and I really love my job, and I hope you see that in these videos. Thanks guys for watching. Bye-bye. The picture quality is not the best, but it can give you an idea of. Hey guys, it's Dr. James Kent. Today we're going to do a Haglund's deformity on this patient's foot. She has a small left foot Haglund's deformity on the posterior aspect of the heel. I'm going to do this minimally invasive. I'm actually going to numb her up with a little bit of nitrous oxide and lidocaine, 1%. Once she's completely numb, she's just going to turn on her over on her back side. I'm going to make a small little incision with a small 64 blade. I'm going to find the Haglund's deformity with a small C-arm. Once I find it with the C-arm, I'm going to use a small Shannon-type burr and actually burr out the small bone spur. And so this should go real easy, real well. Probably the tourniquet time will probably be less than 5 minutes, but once you, less than 5 to 10 minutes, but typically these go real well. Small little piercing on the side, on the lateral aspect of the foot, on the posterior aspect of the heel, go in there with a small little beaver blade and go in there with a Shannon burr to grind that out, and then close it up with 1 stitch, and typically they're fine. And typically I like to have patients be non-weight bearing for about a week to 3 weeks, and then after that she's in a small cam boot for maybe 2 or 3 weeks after that. So this should go real easy, and I hope you enjoy the video. Thanks guys. I mean, everything that I'm using here you can get from Guild Podiatry for the most part. There's nothing secret about this. and anybody's welcome to come to my office, watch. Hopefully you can teach me something as well. I'm very open about new things.
And in less than 30 minutes, voters around the country will be waiting to hear who will be our next president. And tonight's debate in Las Vegas will provide one last chance for huge numbers of Americans to compare Hillary Clinton.
By the way, this patient was fairly small. The patient really wasn't that overweight. Trying to open that. Can you scoot that closer? What do you think? And another thing I suggest, just take your time, right? I mean, this isn't a race. Go for it. So obviously this video was short, but it took longer than this. Just take your time. Honey, you okay?
Yes.
I'm nearly done. Great.
You want to post a picture? Questions?
So you exsanguinate the extremity before you perform the procedure?
Yes, and yes. I don't like a lot of bleeding, but lots of times I will let the tourniquet down, let it bleed out. So I'm both. Again, I'm kind of a hybrid. Sometimes
It's smart, because one of the problems is it bleeds so much.
well, yeah, and that's the reason why I broke that bit and couldn't get it out, and I had to take this guy to the ambulatory surgery center, and he got a bill for $5,600 because of my fault. Okay, so you're right.
Now you're right. Control the bleeding.
Anyway, the guy in the white shirt.
You use the tourniquet, an ankle tourniquet, a thigh tourniquet?
That's smart.
Ankle.
Is that, I'm sorry, wouldn't that?
It's just a Delphi tourniquet. Simple. You can buy them at Go Podiatry.
Wouldn't that be putting pressure on the Achilles to put it down?
To me, it really doesn't matter. I mean, you're taking out the Haglins. Yeah. And again, we're not ripping the Achilles tendon apart. We're making a tiny, minimally invasive. There's hardly any detachment of the Achilles.
How about pain during the procedure from the tourniquet?
You know, people ask me that all the time.
What was your question?
What do patients have much pain with the tourniquet? Believe it or not, you know, a lot of residents ask that question, and a lot of people that are hospital-based ask that question. Really, we don't. We don't have that much pain. And again, you have to realize my procedures are anywhere from 5 to 15, 20 minutes. I mean, we're not doing a 2-hour surgery. I mean, come on, people. This is MIS. Get in there, get out, let the patient walk home. So, just do an ankle block. Give them nitrous oxide gas. In Texas, we can do that. Okay, 40% for about 5 minutes. Give them a little ankle block.
And the PSI of your...
Anywhere, great question, 250 to 300, but usually 250.
We
Yeah.
don't have questions at the
Yeah.
end.
Yeah. I mean, I'll answer any question you want. Sorry.
So go ahead, take it.